talk about how healthy West Hertfordshire is. When we're buying or commissioning health services, we want to start with what health services are actually needed by people. What will work, what do people want, what will make people as healthy, or help people become as healthy as possible. Next slide. When we're doing that, we talk about a formal process called health needs assessment. We want to look at the numbers, the data, the epidemiology, and we're going to take you through some of that today. We want to think about how do services compare to other places, and how do the outcomes compare to the kind of amount of money that we're spending on them. And I'll take us through a little bit of data on that today as well. And then the third part of any health needs assessment is what does everybody else think? What do people who use the service or provide the service think? And that's a kind of point of why we're here today. So I'm not going to present anything on that. That's what part of the discussions for today are about. The County Council, I'm a public health consultant, and we're being moved to become part of the County Council. And one of the duties we will have there, along with colleagues, is to contribute to something called the Joint Strategic Needs Assessment. There are a couple of people in the audience that I'm going to now make stand up, and I haven't warned them about that, because I want to say thank you to them. So there's Mark Jordan, who's standing here, and Julia Lisk, who's on the other side, who's smiling wryly at me. Both Mark and Julia, for their respective organisations, Hertfordshire County Council and NHS Hertfordshire, spent huge amounts of time doing all of the work on the Joint Strategic Needs, and quite a number of the slides I'm going to show today I have stolen from them, thanks to them both. The Strategic Needs Assessment is a website that they've pulled together, and this is the, sorry, previous slide. This is what the website is going to be looking like. It's on the web already, but Mark's knee-deep in revamping it. The aim is to pull together all of the information that we have about the local population into one source that we can then use to commission services. And in your information packs, if we go to the next slide, there's a document with a front page that looks something like that. And what Julia has done is pulled together some of the data and some of the information to give a summary for here in Park Valleys. And I'm going to quickly whiz through what some of the slides are showing on what health is like for the population here in West Hertfordshire. Looking at these kind of issues, life expectancy, lifestyle issues like smoking, alcohol, obesity, some of the use of healthcare services, and what population demographics are doing, our ageing population. Life expectancy in Hertfordshire is steadily going up. And if we look at mortality, the negative perspective of that on the next slide, mortality is steadily coming down. It's really clearly steadily coming down year on year on year. And this slide is showing those health conditions that are amenable to healthcare. In other words, this is telling us something about the quality of our health services. They're making an impact on the things where we would expect them to make an impact, because conditions that are amenable to healthcare, fewer people are dying of them. If we look at the next slide, that's a subset of that data. So this is people dying from coronary heart disease, also really clearly going down. And going down about in average to east of England. So if you can see the slides, the blue is our local data, the green is east of England. There's really, frankly, not a lot of difference between those two. If we look at the next slide, similar story, but not as steep a gradient for respiratory disease. But deaths are still coming down. Of course, one of the reasons why they're not coming down perhaps as fast as they could is shown on the next slide. Smoking prevalence. We still have people smoking. We want to still work with people to try to encourage people to quit. The green line is at about 20%. So around 20%, somewhere between 15 and 20% of people living in Hertfordshire are still smoking. The only place significantly below the East of England average, for reasons I can't fully explain to you on this graph, is Herts. But prevalence tends to be slightly below average for England across all of West Hertfordshire. We've got the next slide. This is the next of, that one. This is the next of the issues that's facing us as a population, is obesity. As food and diet has become more calorie dense, and as our lifestyles have become less active, more and more of us have put on more and more weight. And I don't really need to tell anybody that, we know that. But we're now looking at somewhere between 20 to 25% of people are overweight or obese. It's becoming a really, really big issue for our population. I've got two more issues that we need to be thinking about. This is deaths from chronic liver disease. Now, one of the biggest contributors to liver disease is alcohol intake. And that's going up. That's bucking the trends of health in Hertfordshire. It's doing that all over the country. We are consuming more alcohol, we are seeing more deaths from liver disease. And that's a concern. It puts a big demand on health services. It's a negative impact on people's health, even if it's not as serious as this. And it's something we need to put our heads together and think, what more could we do? And then the final slide of these sets of data. This is the population over 65. Not an awful lot we can do about this. We can't try to persuade people not to become older, but we need to build this into our plan. By 2035, the number of people aged over 65 will be increased by 70%. The numbers are going up rapidly, and even bigger increases in the over 85s. That's by 2035 will have gone up by about 200%. We have an ageing population, and that's going to have big impact on local services. I know you will not be able to read the detail in this, and I wasn't particularly expecting you to, but what I wanted to say was, in addition to the data on the local JSNA, Regional Public Health Observatory produced data at district council level, and if anybody is interested in these, we can share them. They're all available publicly on the web, and we can circulate the web links. This one is an example, and it's for Herts. It shows us details about population living in the area. And if we go to the next slide, this, you might, to the front, but not at the back, be able to pick up colour coding. Where we're green, and actually a huge amount of Hertsmere is green. These are measures or factors where we are doing better than regional or England averages. So, for example, at the top, this gives us some data on deprivation. We're not a particularly deprived area. Number of children living in poverty, fewer than the national average. We've got a set of yellows coming down through here, and some of those are some of the data I've already been showing you, such as rising obesity, rising problems with alcohol intake, and where we're yellow, and for about a third of these we're yellow, we're in line with average. The challenge is, can we do better? We're in a good place with our health in Hertfordshire, and we need to aspire to do really well. If we have that ambition, who knows what we could reach for. There's one red on this slide, and it's right down at the very bottom, and that's deaths on the roads. Deaths on the roads. So road traffic accidents. That's probably our A roads. It's not the M25. And if you speak to the fire service, they would agree with this. This is the A roads where you can get a bit of speed up, you're outside of the towns, but there's a lot of hazards around. It's always dreadfully sad when people die in road traffic accidents. It's usually a death long before someone's time. And 2 or 3 of the district councils in this area, that figure comes up. It's telling us something about our geography and the way things are laid out here. Use of cars, the kind of roads that are around. But it might be an opportunity to try and do something to improve that.
Does that include cyclists and pedestrians?
Jim's asking me if it includes cyclists and pedestrians. Yes, it does. It's road traffic accidents, so it's both in vehicles and people hit by vehicles. Yeah. socioeconomic status or deprivation across the county. The darker the area, the more deprived the ward. And what's really striking about this is the amount of bright blue that you're seeing. So lots of really quite affluent areas, and Harpenden and Wheathampstead. But then there are some pockets, down into Borehamwood, Herts, some of the wards in Hemel Hempstead, Watford Three Rivers, that are more deprived. It's all relative, but we do have pockets of deprivation within a quite affluent home county. And this matters because, as this slide is showing, the number of years that you live for is strongly, strongly influenced by the socioeconomic circumstances you live in. If you live in deprivation, you die younger. And if we come across this graph, somewhere between 60 and 65, for those living in most deprived, that's women. Sorry, it's disability related thing. Somewhere around 70 to 75, so there's a 10-year age difference there. And that's shown again on the next slide. So if I were to pick an area, I'm going to pick St Albans and Harpenden because it's the first on the graph up here. If you lived in Harpenden South, your life expectancy would be about 85. If you live in Southwell, it's about 76. It's a 10-year age gap. When we're commissioning services, we need to think, how do we do something about that? If I take the Decorum one at the other side, sorry. Elstree, again 76. Oldham East, 85. So again, a 10-year gap. And all of those things are showing pretty much a 10-year gap within each of the district council areas.
Doesn't this rather make a case against large CCGs? Because you're talking of areas which are quite disparate.
So I've just been asked if this makes a case against large CCGs because the areas are so disparate. We could debate that for the rest of the afternoon. I'll give you my opinion, but it is just my opinion, and it's not me who's the one who chooses how to set up the CCGs. These are differences within a district council area. So each locality has these issues to deal with within its own geographical boundaries. And I suppose the other thing I would say is we use geographical area and the average affluence or deprivation of a ward as a proxy measure. But not everybody who lives in a deprived ward is living in deprived circumstances. And not everybody who is deprived lives in a deprived ward. So while you can do some of this geographically, there's more of an art to meeting things and making sure offers are equal and everybody has the same chance than just looking at area. But it's still an interesting debate. We'll probably come back to it when we talk on the tables. So, if we go to the next slide, all of this data and information that we have about the health of the population in Hertfordshire has been plugged into a process by the Health and Wellbeing Board. We have a number of people here from the Health and Wellbeing Board, which is run across Hertfordshire. So Nicholas Small is the chair of Hearts Valleys, and I can see Colette City, or you're a member of the Health and Wellbeing Board as well. And forgive me if I've missed somebody else in the audience as well. They've done a prioritisation exercise to identify what we think are the top priorities to improve health and well-being across the whole of Hertfordshire. And this is the list. It splits into 3 groups. There's something about healthy living, something about helping people live independent lives, and something about helping communities to flourish. So in healthy living, reducing the harm caused by alcohol, that fits really neatly with the data I've just been showing. And similarly, reducing the harm caused by tobacco. And finally, promoting physical activity and healthy diet in order to maintain a healthy weight. The obesity issue that I've shown. Living independent lives. Supporting people with learning disabilities. Living well with dementia, really important given our ageing population. And enhancing life for people with long-term conditions. The that will influence how healthy you are in older age tend to be your experience of long-term conditions, coronary heart disease, diabetes, respiratory disease. The healthier we can keep people with these conditions, the more independent lives they'll be able to lead. And then finally, helping communities, helping families to thrive, supporting carers. Without carers, we would be lost. They are an unseen army that we are completely grateful to and utterly dependent on. And we need to support them as well as we can. And then finally, improving mental health and emotional well-being. One of the phrases that's floating around at the moment is no health without mental health. And I think we sometimes can forget to include mental health and think just about physical health. And this is a challenge to prioritise it. So that's a bit of a run through of what the data is showing us in terms of health outcomes. But when we think about commissioning services, what we want to know is what are we spending and what kind of outcomes are we getting for that. So I'm just going to run through some concepts and some ideas and show a little bit of data on some of the thinking we can do to say, when we're buying services, are we getting value for money? And I'm going to just briefly show something called a spot tool. And this is talking about something called program budgeting. And there's a number of different tools around, and the one I'm going to use is being produced by Yorkshire and Humber Public Health Observatory. So, credit check to them. Go to the next slide. When we think about the total pot of money we have, we can divide it up. And we can divide it up into pots of money or sums of money for different types of conditions: mental health, cancer, respiratory, cardiovascular disease. And each of those we could look at in isolation, and it's a programme budget. Or we can dig into that in a bit more detail. And we can say, okay, if we're spending money on respiratory disease, which of the diseases would we get? Do we need to spend the money on? Would we get better outcomes for it? Is it chronic bronchitis or COPD? Is it asthma? Or even, if our issue is chronic bronchitis, COPD, where do we get the best value? Is it spending time and money on rehab? Is it drug prescribing? Is it oxygen at home? Where do we spend the money? So we can, if we go to the next slide, we can do some fancy stats, or actually, to tell the truth, we can get the Public Health Observatory to do some fancy stats. And I'm not going to try and explain the stats completely. But basically, what we're doing is saying, if we compare how much money we spend on a group or a programme budget, and we look at the outcomes that we get, where do the two map together on a graph? So on this, the lowest spend at this side, high spend at that. Other way around, poor outcomes at the bottom, good outcomes at the top. You want to be above the horizontal line. You want the outcomes to be good. So you want to be up here rather than down here. Because of the way the funding works for the NHS, if you live in an affluent area, you get less money than if you live in a deprived area. And Hertfordshire gets about 70% of the average. So we're arguably relatively underfunded. So what we need is our programme budget to be this side of the spend. We want really good outcomes for the best value for money that we can possibly get. And the next slide shows roughly where our spend outcomes are at the moment. And the really reassuring thing is almost everything is up above the line. So outcomes are on the better side of average. Each of these dots is a different programme. You won't be able to read them from where you are, but for example, this one is our cancer services. We're getting quite good outcomes and spending less than the average. This one is mental health. Something like here is circulatory disease. There's not masses of differences between these red dots. There's nothing in where you're spending money that is a major outlier. But because of the way the formula works, the challenge, and you hear it being talked about as the quick challenge as well, quality, innovation, prevention, And the challenge is to get everything over to the left-hand side and up into that top quadrant. How do we get the best outcomes possible for the best value for money for our population? I've got one more slide that's even more multicoloured than that. And we can sit down and share this tool and play with it if people are interested in it, because you can ask lots of different questions. This one is mortality from coronary heart disease. And we are, for Herts values, this big grey dot here. And the red dots are other CCGs in Eastern region. The yellow dots are other CCGs that have populations that are like ours. So home counties, places like Kent, Surrey, Sussex, perhaps Essex. If you look at those, outcomes are as good as anywhere. They're fairly high up on that quadrant. But again, there's a challenge. Could you move this to the left, get better value for money, without losing the outcomes? In other words, what does this one here do? Could we learn anything from them? Could we get ourselves to there? Because that would maintain the kind of outcomes we're getting, but being more affordable, thus releasing money to spend on other services. So, we have an ageing population. We know that because we see pressures on A&E, on emergency admissions. Both health and social care sectors are very, very busy, overwhelmed, see the pressures. We know that more and more people are living longer and longer with diseases such as coronary heart disease, diabetes. Our treatments are getting better, fewer people are dying of them, but this creates a need for the health service to be as good as possible in helping people look after themselves with those conditions. There are some projects underway looking at whether we can do this better. I don't know, Nicholas, if you're going to talk about Home First in your talk.
Yeah,
So Nicholas will talk a little bit more about Home First, which is a project that they're working on in Herts. Big set of challenges for commissioning. The other challenges are, how do you address inequalities? How do you make outcomes fair for everybody? How do we get into those prevention and lifestyle issues? How do we get fewer people smoking, fewer people binge drinking and causing themselves harm? Public health's always a killjoy when it comes to these things, isn't it? So I'm going to add, I'm not eating too much while we're in there, so all the pleasures being slightly challenged by me. And how do we do that between all of the different competing needs? And I put up one possible suggestion, which is look at programme budgets. If you spend it on cancer, you can't spend it on mental health. How do you prioritise between the two? That's all of the data that I'm going to take us through today. We just go to the last slide. The data, the sources I've put are in these references, and if we're circulating the slides, those are hyperlinks, so you'll be able to find them. And finally, just another thank you to Mark and to Julia. They will recognise more of these slides than men. Thank you very much.